Santa Clarita's hometown station, KHTS. I am Kyle Jellings in for the City of Hope show on your hometown station, KHTS. We do this every month. First Wednesday of the month, we get to sit down with some of the great doctors and different staff members over at the City of Hope in Santa Clarita. You can go check out their facilities. You can go to cityofhope.org/Santa Clarita to learn more. But they're in Santa Clarita. They're on Valencia Boulevard, right across from City Hall. So it's not too tough to get there. Or you can keep listening because we're going to talk about it also. So make sure you keep it tuned here to your hometown station, KHTS. Again, we have some very special guests in studio. We have Mandy Eggleseder. I got it right the first time, I think, and that's the first time I've been able to.
You nailed it.
I nailed it right off the bat. Okay, so I've set the bar pretty high. Now, I do have a doctor of urology at City of Hope, and it is Dr. Jaspreet Parihar.
That's correct.
All right, I did it. All right, good. All right, so far so good.
Yes.
We're off to a good start. And he's going to be our doctor we're spotlighting today. But first, I'm going to give Mandy the floor. Mandy, what are some of the services, some of the great things you guys are doing over there at City of Hope?
At City of Hope, if you haven't been before, we obviously have our campus located in Duarte, where we're known for research, cancer treatments. However, we have community practice sites where we can treat patients locally. So that someone who gets diagnosed with cancer in Santa Clarita doesn't necessarily have to drive all the way to Duarte or anywhere for that matter. We're a pretty good community partner where if you are diagnosed, you don't have to drive, you can stay local. We're specialty care with cancer, so we provide everything from medical oncology to surgical oncology, general urology, urologic oncology, breast surgery, gynecological cancer. I can't even say it today.
No, I got you.
Gynecology cancers, but we offer quite a comprehensive.
Yeah. And the thing is about City of Hope, like you said, if you are diagnosed, you don't have to go down to Duarte or UCLA or all that stuff. It's right here in the Santa Clarita Valley. And the Santa Clarita Valley is kind of a weird place where it's a big city, but it's kind of a lot of commuters live here. And that LA traffic, depending on, how traffic is, it can go to get to LA, it could be
Absolutely.
40 minutes or it could be 4 hours. So this is an awesome facility. You can go check it out. You go to their facility. It's in Valencia, again, on Valencia Boulevard, right across from City Hall, right next to that Bank of America building on, I think it's Citrus. Is that Citrus, that corner right there?
We're right on, it's Citrus and Valencia Boulevard.
Yeah, right there, that corner.
Yep,
yeah,
that one.
Yeah, I know stuff. Yeah, but we have in studio, again, we're spotlighting every month. We spotlight one of the doctors over there, staff members at the City of Hope. Again, cityofhope.org/Santa Clarita. And today we have Dr. Parihar, and his specialties are urology and urologic oncology. Doc, how are you?
I'm doing well, thank you, Kyle.
Thank you for being here.
It's a true pleasure to be here and to be able to discuss important topics to the community. And
I'm glad that I've done this a few times now. I'm glad there's not rumors around City of Hope saying how awful it is to come on this show. So I feel like I'm keeping you guys coming back.
We like you a lot.
Okay, so that's a win. All right, so that's a win. So that's awesome. So let's talk about you, Doc. Doc, when did you? Where are you from originally?
So my background is I'm from India.
Okay.
I was born there, spent my early childhood there, and came to U.S. with my parents when I was about 11.
Okay.
And grew up in Pittsburgh area. So Steel Town country, and Steelers and everything. They go to
we have a Tom Nobilly here in the back. He does graphics, and he's an insufferable Steelers fan. It's awful.
Steeler Nation.
Oh, see, this is going to be a problem now. This is officially a problem.
So
okay.
I did my education in Pittsburgh and undergrad at Duquesne University, in the basketball school. And then medical school in Philadelphia, Drexel, formerly known as MCP Hahnemann.
Okay.
And for residency training, I went to Rutgers University in New Jersey. So, between all the places, I've had pretty broad experience. Following residency, I wanted to really hone my skills on the robotics and minimally invasive options. So that's what brought me out here to California and with City of Hope. City of Hope has a very excellent reputation. In California, they were among the first institutions to start robotics program, specifically for prostate, for kidney, for bladder tumors, and with tremendous amount of experience. And I felt this was a right place to be, and the right place for completing my fellowship training. So subsequent to that, I've stayed on faculty, and I'm very happy to join the City of Hope staff and to be able to work in the community settings and really help the people who need it the most, and without having to have the patients travel an hour or two in the traffic. So we provide the care locally, and that's what we're trying to do.
Yeah. So I wanted to ask you, when did you? We're speaking with Dr. Parihar, and he is at City of Hope. His specialties are urology and urologic oncology. I wanted to ask you, when did you realize you wanted to be a doctor? Is it a legacy thing? Was your dad a doctor? Was your mom a doctor? Or is it something when you were 11, you got here, you're like, you know what, I want to be a doctor? What was the process there?
Both my parents are not physicians. However, I do have some family members who are, and I was always interested in sciences and biological sciences and anatomy, human physiology, and I really got inspired by my uncle, who's a urologist as well.
Oh, really?
So I went into sciences and medical school thinking that urology is a good option, but ended up eliminating amongst all the other specialties. It's a really exciting field. I think to be able to make a difference in patients' lives when it really matters the most to them it's a pleasure, and it's an honor, and it's I couldn't have I think chosen a better field.
So going into college, did you knew you wanted to be a doctor?
I knew that I wanted to pursue medical sciences. Yeah.
Okay.
Yeah.
And when you were there, or when you were doing your, I think it's called rounds. I think is where you go to different subject matters.
Yes.
Yeah, rotations. There it is. What was the types of medicine that stuck out to you the most? Obviously, urology and oncology, but was that your goal from the start?
I wanted to be a surgeon just because of you can make improvements with your own hands and with your own skills.
Yeah.
A lot of medicine is becoming chronic medical care, medicines and things like that for this and that, but there are only certain specialties where you can make immediate improvement on patients' outcome. So I was always interested in surgery, and the thing about urology is that I've found through my rotation experience that urologists are amongst the happiest surgeons.
Okay.
So they subject matter is light, and they take the things lightly, and
Okay.
It's a lot of fun. It's a lot of technology. I'll be talking to you about robotic surgery and minimally invasive options, and how that has really revolutionized a lot of surgical fields these days. The surgeries that used to take a long time to heal from and require lengthy hospitalizations can be done in overnight, and next day the patient's ready to go home. So it's a lot better for the patients, and just I think society as a general.
Yeah. So I this is not related to oncology. My uncle got his hip replaced, and he did it in the early '90s, I want to say, and he was out for I think 3 to 4 months, maybe longer. He literally could not walk, and now. A friend of mine's dad just got his hip replaced, and he was up and at it in a month. And that's crazy to me. That's crazy, and that has to do with the robotic stuff that you're.
Right.
You're
I mean, the
talking
goal
about.
is to fix the problem, fix the issue that patient's having, without causing other issues for the patients.
Yeah.
So if you can do that in a minimally invasive fashion and achieve the similar oncologic outcomes or surgical outcomes, then that's really the goal of medicine, I think. More personalization, and faster recovery to your own life.
Gotcha.
So,
again, we're speaking with Dr. Parihar. He is his specialties are urology and urologic oncology. Are those do those go hand in hand, or could you have just been a urologist, or is urologic oncology kind of they go together?
So urology requires residency training.
Okay.
And if you want further specialization in the cancers, then really a fellowship is key. So urology in general deals with anything from kidneys down to the genitalia. So problems that affect the kidneys, making of the urine, kidney stones, blood in the urine, enlarged prostate, urinating too often, going up, rushing to the bathroom, urinary tract infections, okay, herniations of pelvic organ prolapse, leakage issues, urinary tract infections, sexual transmitted diseases, and then urologic oncology deals with cancers of these organs.
Okay.
So kidney cancers, ureteral cancers, bladder tumors, prostate tumors, urethral, penile, testicular tumors.
Okay.
Those kind of.
So what was it? Because obviously, you could have just done urology, but what was it about the cancer treatment? And this is a heavy thing. It affects a lot of people,
Yeah.
And it's a very sad thing for some families to go through. Why did you want to specialize in that?
Cancer affects not only the patient, but their spouses, the family members, the children. And it's one of those diagnoses that if one hears, that it really disturbs people and can cause a lot of anxiety in patients. So to be able to help address that and to make a difference, at that time, at that crucial moment, I think, and to help guide the patient through the treatment, through surgery, to post-operative care, and really try to eliminate cancer, that's where I wanted to be in the setting of urology. So
again, we're speaking with Dr. Parihar, and so is it something that did you want? Because there's some doctors that maybe just want to be a doctor, and I feel like sometimes when I go to the doctor, they're like, "All right, here's some penicillin or amoxicillin, we're on with you." Is having to work with the family and other friends and stuff like that, is that something? And you work probably and hopefully I never have to know this, but the cancer patients, you work with them a lot. You almost become part of their family. Is that something that interests you, or I assume it did, but why did that stick out to you?
as I said, just because it's a crucial time in patients' life when they hear that diagnosis. And if I can do something to help put them at ease, if I can treat them, if I can get rid of their cancer or prolong their life or improve their condition, I think that's where I think my skills would serve the community at best. And working in an environment where you can rely on your medical oncology colleagues, radiation oncology colleagues, as well as other surgeons, I think it's really a team approach. So I wanted to be in a setting where I can practice in that fashion, and offer patients treatments that can help.
And was it City of Hope? Did you notice that team atmosphere right when you got in there?
Yes.
Yeah.
Yes. It's really different feel. Obviously I've been training at different institutions, but arriving in City of Hope, it's really about the patient, and they treat the patient in a holistic fashion. So it's just not the patient, but their family members,
Yeah.
the nutritional status of the patient, working hand in hand with their current medical doctors, and the culture of kindness and the compassion that is offered at City of Hope. I think it's really unparalleled, and I'm very happy to be part of this institution.
Awesome. Again, we're speaking with Dr. Parihar. Mandy Eggleseder is with us as well. And we're talking, this is the City of Hope show on your hometown station, KHTS. We're going to take a quick break, and then we'll talk specifically about urology and urologic oncology, maybe some of the different cancers that there are, which we touched on a little bit, but different cancers there are, and some treatment stuff, maybe some preventative care as well, on the City of Hope show. This is the City of Hope show on your hometown station, KHTS.
Daily Imprints is the premier one-stop shop for custom embroidery, screen printing, and promotional products in the Santa Clarita Valley. Owners Joe and Dana have provided KHTS with quality embroidered company shirts for over 3 years. If it's new business cards or promotional products you need to enhance your image, Daily Imprints is the choice for you. Located on Lyons Avenue, stop by or call today, 661-678-0508.
Drugs or alcohol abuse can tear a family apart. In Santa Clarita, just like everywhere else, it's an epidemic. The Way Out Recovery is here to help. Call them now at 296-4444 or visit them on the web at thewayoutrecoveryscv.com. The Way Out offers outpatient treatment for adolescents, adults, and family members. The Way Out is compassionate, caring, professional, and confidential. You and your family don't have to suffer any longer. Call the Way Out Recovery now, 296-4444, or visit thewayoutrecoveryscv.com and make an appointment. Asking for help is the first step.
It's no wonder people love Baskin-Robbins, as it's known for its 31 flavors of ice cream. From ages 1 to 99, people visit Baskin-Robbins anticipating the pleasure of enjoying their favorite ice cream, served any way they want. They also create customized cakes for any occasion. With several locations in Santa Clarita, you're sure to find America's favorite neighborhood ice cream shop near you. Visit them in Steventon Ranch on the Old Road, on Soledad in Canyon Country, or on Lyons in Newhall.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
Do you like to rock across Africa?
Then the wait is over.
Africa Rocks! Africa's Greatest Hits is now available at the San Diego Zoo! And who could forget 99 red baboons?
Or the African crested porcupine smash hit, I Got Quills to Pay the Bills! Hey, don't get too close!
And the hits keep on coming!
Africa Rocks has all your favorites from 6 different African habitats.
Hungry like a leopard.
Ibex is back.
Harder, better, Fossa stronger.
And a new track from Kendrick Lamar.
Now, Larry.
Yes, Chuck?
A collection of this magnitude, I'd fly to Africa.
Well, don't pack your bags, friend. Africa Rocks is only available right here at the San Diego Zoo.
Wow, that really does rock.
No, it Africa Rocks.
Welcome to Africa Rocks, now open at the San Diego Zoo. Coca-Cola is proud to be the official beverage sponsor of the San Diego Zoo and Safari Park.
City of Hope is a world leader in cancer research and treatment. And there's a City of Hope community practice location right here in Santa Clarita, eliminating a major barrier in the fight against cancer: distance to quality care. Santa Clarita benefits from City of Hope's compassionate care and renowned clinical expertise. We offer many services at our Santa Clarita location, including medical and surgical oncology, infusion therapy, and chemotherapy. Our City of Hope Santa Clarita physicians maintain a close relationship with your primary care physician to ensure you receive the best care. City of Hope Santa Clarita is conveniently located, has world-class physicians, and accepts a wide variety of insurance plans. To learn more, visit cityofhope.org/Santa Clarita or call 661-799-1999. City of Hope, the miracle of science with soul.
Hometown.
I wanted to let you know that I really appreciate the way you guys do what you do.
Your hometown station.
I can change the world. I'll be the sunlight in your
Santa Clarita's hometown station, KHTS. I am Kyle Jellings. This is the City of Hope show on KHTS. We do this once a month. It's the City of Hope show. We spotlight a doctor from City of Hope, and we talk about all of the wonderful services they offer there. You can go to cityofhope.org/Santa Clarita. Check out their Valencia building. It's on Valencia Boulevard, right across from City Hall. It's on the top floor of that medical building on that side. So go check it out. And Mandy will probably give you a tour, right?
Yeah.
If you have to now.
Find me.
So,
I have to now. I'm committed.
Yeah. But again, the City of Hope show, we're speaking with Dr. Parihar, and his specialties are urology and urologic oncology. And to reset here, Doc, let's talk a little bit about what exactly is urology for those who may not know. What is urology and urologic oncology?
So basically, urology is anything to do with the urinary system, the genital urinary system. So anything from production of urine from the kidneys down to the male genitalia, female genitalia.
Okay.
And involves, the kidneys, the tubes that drain the kidneys into the bladder, the ureters, the bladder itself, and prostate in men, urethra, and the external genitalia.
Do you specialize, is it male and female patients? You
Yes.
cover both? Or
Yes.
do you have a specialty? Is there's somebody that knows more about female urology, or is it just one?
There's always a blend of urologists and gynecologists
Okay.
who, who there's some overlap in the female urology side. But as urologists, we are trained for male and female
Gotcha. Okay.
systems. Absolutely.
Okay. And then, so any of those body parts that get cancer is urologic oncology. Right?
Exactly.
Okay.
Exactly.
And you wanted to specifically talk about prostate cancer. And I wanted to ask you, what are do you have some statistics about prostate cancer in terms of how many people have it, get it, all that stuff?
So prostate is a sexual organ in men. It's about the size of a walnut and more or less the shape of the walnut.
Okay.
Usually it starts growing in men as we age. So the enlargement of the prostate is called BPH, or benign prostatic hypertrophy.
And that's a normal thing that happens?
That's an age-related normal thing.
Gotcha, okay.
Some people from that enlargement of the prostate start suffering from urinary symptoms.
Okay.
So whether it's going too often, getting up at night a lot, having to strain or push to get the urine out, sometimes having some bleeding related to prostate enlargement, prostate infections. You're more likely to form stones of the bladder if you have enlarged prostate, and also bladder infections.
Is that different than a kidney stone? Or is
that
the
is
same
different
thing?
than
Okay.
kidney stone. Kidney stones are usually metabolic or infectious, but bladder stones are typically either infection or related to outlet obstruction.
Okay. What does metabolic mean?
Metabolic mean, the level of acid base in your blood that is filtered in your kidneys. So kidneys are essential filters of the body.
Okay.
So, then they excrete the waste products, ammonia, acids, phosphates into the urine.
Gotcha. Okay.
So a metabolic derangement in those constituents can precipitate into stones.
Okay, gotcha.
And the
Which is
stones,
painful.
absolutely.
Yeah.
The stones can grow with time, and start traveling down. And when they travel down, that's when patients become symptomatic.
Mm-hmm. My dad had kidney stones, and my grandfather had kidney stones. So it's only a matter of time, I feel like, that before, unless I just drink water the rest of my life. It's
Some
just
people are, it's familial, and but a lot of it has to do with the regions of the U.S. So especially
really?
in this region, Arizona, where there's a lot of heat,
a
lot of hot weather, and
patients
are not drinking enough water.
The Jellings have been here since the 1950s, so there you go. There you go.
So,
sorry, I got you off track.
A lot of this is dehydration related, and
Okay.
So
I just got thirsty when you said that. Oh my gosh. Okay. Okay. So back to we kind of derailed there. Prostate, it begins to grow. You get the stones in the prostate area, right?
In the bladder.
In the bladder. Okay. And then and that's a normal thing for men.
So
are the stones normal too?
Stones are not normal.
Okay.
They can cause more issues.
Okay.
They can cause infections and things like that.
Gotcha.
And they can be painful if they're trying to come out and get obstructed in the urethra. Of course, as you can imagine, that'll be painful. So that's one issue with the prostate, age-related enlargement. And some people do need medical treatments or surgery to fix that.
Oh, really?
To resect the prostate from inside and core out the excess tissue to allow to reduce the outflow obstruction.
And what is there a certain age that happens? Is it constantly happening as a male, or is it?
We typically tell patients about 50% of patients at age 50 have some sort of enlargement going on, and it just grows by decades. So 60%, 70% in patients in 70s.
Okay.
So the other thing with prostate that is important for patients to realize and for listeners to understand is that some parts of the prostate can start turning into cancer.
Okay.
And some of the reasons may be hereditary, ethnicity, and just with aging, you have a lot of mutations that build up at the cellular and the DNA level, and these can transform into unregulated growth and some of those growths can be unchecked, and the body cannot suppress, and it turns into a prostate cancer. And a lot of times the cancer is silent, and you may not have any symptoms from it until it's metastatic.
Okay, what does that mean? What does metastatic mean?
So metastatic means it's out of the prostate gland itself and spread to other organs.
Oh, good grief.
To your skeleton system, to your back, and your bones.
Okay.
So, but before that, patients may or may not have any symptoms. Sometimes they do get obstructive symptoms, so urinary symptoms. But a lot of times, the only way the prostate cancer is diagnosed is with some blood test and a rectal exam that's done by a doctor.
Is that something that goes missed a lot? Is because men just don't do it, don't get their prostate checked?
I've seen a lot of men who are hesitant for an exam, but it's one of the few cancers that you can actually examine and feel if there's an issue going on.
Oh, okay.
So, it's a pretty simple, quick rectal exam, feeling for the prostate, feeling for the nodularity and size estimate, etc. And then the other part is a blood test called a PSA, or prostate-specific antigen.
Okay.
A PSA is basically an enzyme which is in the prostate, and when it's released into the body, it can be picked up in the blood test, and if the levels are elevated for your age, then that triggers for us to look further, to look for prostate cancer.
Okay. All right. Again, we're speaking with Dr. Parihar. He is a urologist and a urologic oncologist. Is that right? Urologic oncologist? That's what it's called? Okay, good. Because it says your specialties are urologic oncology. I just assumed the IST would go on the end of that. You can go to cityofhope.org. This is the City of Hope show. We highlight different doctors there, and as well as the facility itself, which is right on Valencia Boulevard, right across from City Hall. And we're speaking specifically to Dr. Parihar about prostate cancer right now. And so once the exam happens, there's an elevated level in the blood test, and the doctors notice something. What happens next?
So if there is elevated PSA or abnormal exam, the next step is usually a prostate biopsy.
Okay.
Now, prostate biopsy is performed in the office. It sounds more uncomfortable than it is. We, provide a lot of local anesthesia.
Okay.
Patients are comfortable. It's about 15-20 minute procedure.
Okay.
And based on the biopsy results, then that's when the recommendations can be made for the various treatment options. Now, getting back to some of the statistics you were asking. So,
oh, yeah, right.
Prostate cancer is actually the most common cancer in men, if you take away skin cancer.
Okay.
It's the second most leading cause of death, cancer-related death in men. And if you take away lung cancer.
Okay.
So lung cancer is very lethal, but prostate cancer is right behind it.
Really?
And again, as far as incidence, skin cancer is very common.
Yeah.
But prostate cancer is the second most common in men.
And so, again, does that go back to just not getting diagnosed, just waiting too long to, if there is something that's making you uncomfortable when you're going to the bathroom or whatever, it's just like, I'm just getting older, I'm not worried about it.
Right.
It just.
A lot of it has to do with, because a lot of times it is asymptomatic. So patients may not feel anything or sense something wrong until, things start progressing to a much more level. So, in U.S., about 180,000 men get diagnosed with prostate cancer every year. Wow. And roughly 26,000, unfortunately pass away from the disease process. If you look around, your community and your friends, about 1 in 7 men will be diagnosed with prostate cancer. So it's a very common, diagnosis. But it's something that is not to be afraid of, but to be aware of.
Yeah.
So with proper screening, with proper knowledge and education, these things can be addressed and taken care of.
So so you talk about screening, when does that process need to start for men?
So screening is a moving target, unfortunately, in this topic. Current guidelines with the American Urologic Association recommend men age 55 to 69. As you can imagine, if you have a screening test for any problem, that screening test could be too sensitive. So if there's something that's wrong and the screening test positive and you offer treatment, well, maybe that the problem may not have caused, issues in your life at all.
Yeah.
But so some of the, issues with PSA that might be in the media and, it has to do with overdiagnosis and potentially leading to overtreatment. So elevated PSA not always means prostate cancer.
Oh, okay.
But it is a prostate-specific test. So things like enlarged prostate, as we were talking about with BPH, and also prostatitis, infections of the prostate system, can lead to elevated PSA tests.
Okay.
So, with further testing, physical examination, potentially a prostate biopsy, that's sort of when we diagnose prostate cancer. And these days we're fortunate enough to have additional blood tests available to us, which are more personalized and tissue-based tests. There's a blood test that's available in addition to PSA. If we think that's appropriate, we can order, and that looks at more markers in the body, again stratifying the risk of prostate cancer in a patient. And also tissue-based tests. So in other words, even if you find prostate cancer on biopsy, not all prostate cancers have to be treated right away. So this is the major shift in our field with active surveillance of prostate cancer. So some of the low-grade, low-risk prostate cancers can be surveilled on an annual basis.
It's annual, just once a year.
Once a year, or sometimes even earlier with with annual for the repeat biopsies, but PSA we usually do it every 3 to 6 months.
Oh, okay.
So we can monitor
So you
the
can
presence
monitor
of prostate cancer and potentially treat you at a later date. And the studies have shown that whether you receive treatment right away or at a later date, in certain men with certain pathology, the outcomes are similar. So the concerns about overtreatment, are being quelled with those approaches. But it's like any alarm system, so it's like a smoke detector in your house.
Yeah.
Either you can continue to respond every time it beeps and check further investigate, or you can just take the batteries out. So if a patient and they don't want to get a PSA and examination, well, that's fine. But just realize that they carry certain risks.
There could be a fire.
There could be a fire brewing that gets missed.
Yeah. Again, we're speaking to Dr. Parihar, and he is a urologist and urologic oncologist. And so, how often should somebody get checked for? When should they start going to get the prostate exam? And how often should they do it?
So typical screening begins at age 55 and typically ends at 69, 70 years of age. Now, the screening itself can be personalized. So if you don't have any family history of prostate cancer, nobody around you that family members have had prostate issues, your baseline PSA level is very low, then we can personalize your screening every 2 years, every 3 years, things like that.
Is prostate cancer one of those things, though, that like once you reach a certain age, it's very, very likely to get prostate cancer, right? Did I hear that right?
Yes. So with age, the risk of prostate cancer increases.
Okay.
And chances are, some patients don't even know that they have it.
Yeah.
And unfortunately, they pass away from other heart-related issues, or other cancers. But it is much more common than we realize.
Okay. If your father, say my father has prostate cancer, I should probably, do I start earlier?
Yes.
Normally it would start earlier?
Yes.
Okay.
Yes. So typically about a decade earlier, we start screening you.
Gotcha.
And again, the screening process involves a blood test, which is a PSA, and rectal examination.
Gotcha. Okay. Again, we're speaking with Dr. Parihar. He is a urologist, a urologic oncologist. You can go to cityofhope.org/Santa Clarita to learn more about this. And I wanted to talk to you about so what are the different treatments once you get a diagnosis? You said surveillance is one of them, depending on the situation. And then what else is there besides that? Because surveillance seems like the easiest one, I would think, for a patient.
Right.
But what are some of the other ones that?
So if you're
available?
fortunate enough to have a least aggressive form of prostate cancer, then those cancers can certainly be surveilled. Other treatment options include radiation therapy.
Okay.
So some patients who are not surgical candidates, whose heart lungs are not fit for surgery, radiation is an excellent option. It treats the cancer locally and minimizes metastasis and those kind of things. Radiation itself can be in different forms. One is called brachytherapy, where we can place seed implants that emit radiation into the prostate.
Oh.
So that's sort of an internal radiation that you carry, and
Okay.
over time the prostate gets treated. Other is external radiation, so typical radiation in a machine that targets the prostate
Gotcha. Okay.
externally. And then there's also high dose brachytherapy. So those are the radiation options. Surgery is one of the mainstays of prostate cancer.
Uh-huh.
We recommend surgery for typically patients who are younger,
Okay.
who can tolerate surgery and recovery. And it's one of the only treatment options that can afford a potential cure for the patient.
Okay.
Other treatment options include cryotherapy, where
Really?
we can freeze the prostate while still inside your body.
No kidding.
Newer treatments include HIFU, or high-intensity focal ultrasound, basically high energy that is ablating the prostate.
Really?
So there are a lot of treatment options. Within surgery is what I have expertise in, and I can tell you that most men end up either choosing surgery or radiation.
Okay.
But certainly other treatment options exist.
Yeah.
And a thorough discussion needs to be held of
Yeah.
what the patient's wishes are, the goals of the treatment outcome, the age of the patient, and overall health.
And that's one of the things at City of Hope. They take into consideration everything, and they give you all the options. It's not just this is what you have to do. Maybe in some cases it's this is what you have to do, but for the most part, they try to find what's best for you and your family. We're going to take a quick break, and we're actually going to wrap things up on the City of Hope Hour with Dr. Parihar. He is a urologist and urologic oncologist at City of Hope. Go to cityofhope.org/Santa Clarita to learn more. We'll be right back after this.
City of Hope is a world leader in cancer research and treatment. And there's a City of Hope community practice location right here in Santa Clarita, eliminating a major barrier in the fight against cancer: distance to quality care. Santa Clarita benefits from City of Hope's compassionate care and renowned clinical expertise. We offer many services at our Santa Clarita location, including medical and surgical oncology, infusion therapy, and chemotherapy. Our City of Hope Santa Clarita physicians maintain a close relationship with your primary care physician to ensure you receive the best care. City of Hope Santa Clarita is conveniently located, has world-class physicians, and accepts a wide variety of insurance plans. To learn more, visit cityofhope.org/Santa Clarita or call 661-799-1999. City of Hope, the miracle of science with soul.
There's a classic diner in town that combines old-fashioned dining with a hip 21st century menu. They call it trendy nostalgia. They call it Kathy's Deli. Kathy's Deli is a classic diner. Homemade jams, freshly baked breads, and even unique flavored coffee creamers made on site. Experience the fresh, new, yet old-fashioned taste of your local hometown diner. Serving traditional and unique breakfast and lunch delights every day from 7 to 3. Kathy's Deli on Lyons Avenue off Wayman Court.
Healthcare can be difficult if you're underinsured or have Medi-Cal. Samuel Dixon Family Health Center can help. Services are available on a sliding fee schedule. The mission of the Samuel Dixon Family Health Center is to give the Santa Clarita Valley access to affordable, quality primary care. There are 3 locations to serve you: Canyon Country, Newhall, and Valverde. Go to sdfhc.org for more information and to find the location most convenient for you.
KHTS is searching for veterans who are looking to start a new career. We've teamed with the Lifton Institute right here in Santa Clarita. If you're a vet, they've designed a program just for you. In 10 short weeks, you'll develop the skills to land a job in the film and TV industries. Lifton graduates are placed in industry jobs. Free, unique career training right here in Santa Clarita. Visit jobsforscvvets.com. There's no catch. It's free, but it's up to you. jobsforscvvets.com.
Hey there, I'm Tori with your hometown station weather. A nice day today, sunny, but hot temps, a high of 96. Starting tomorrow, a little bit of a cooling trend with highs only in the low 90s. Overnight lows this week ranging from the upper 60s to lower 70s. Real Shadows Premier Bodies Art Exhibit is at College of the Canyon Student Center Cafeteria on Rockwell Canyon in Santa Clarita on September 27th. For more information, go to hometownstation.com.
I can change the world.
Santa Clarita's hometown station, KHTS. I'm Kyle Jellings. This is the City of Hope Hour on your hometown station, KHTS. Go to cityofhope.org/Santa Clarita to learn more about their awesome Valencia's facility. It's on Valencia Boulevard, right across from City Hall. It's the second floor there. Suite 250 to be exact, on Valencia Boulevard. And we're speaking with Mandy. Sorry, you haven't had a ton of time to talk.
Yeah, Mandy, I'm the fly on the wall.
Yeah, Mandy Eggleseder. She is with. She's the
Physician Relations Liaison.
There
it's a mouthful.
That one. And we also have Dr. Parihar. We've been spotlighting him. He is a urologist and urologic oncologist over at the City of Hope. And we were talking about treatments for prostate cancer. And what I wanted to ask you was, you're also heavily involved with robotics as well. And that is one of the treatments as well for prostate cancer, correct?
Yes, absolutely. So, back, 15, 20 years ago, the prostate cancer treatments were performed in open surgical fashion, which would mean a lower midline incision.
Oh my gosh.
Surgery would take 2.5, 3 to 4 hours. It can have a lot of blood loss. It's one of the areas in the body that holds a lot of blood. The surgery, required patients to stay in the hospital for several days, if not up to a week or so. It's a long incision. It's a big incision. It's a muscular. It goes through some of the rectus area, so it can be painful. So
recovery, I can only imagine.
Since about 2001, when the robotics was introduced to surgery field, urologists have been the pioneers in adopting it for the surgical treatments.
Oh.
The Da Vinci robotic system was initially developed for the use of military to do and space to treat remotely,
yeah,
to perform operations remotely. But obviously medicine has taken it and with open arms, and it's extremely common now. In about 2008, about 85% of the prostate cancer treatments are done through robotics.
Holy
This
cow.
is becoming much more common. A lot of hospitals are purchasing these systems and getting involved in robotics. As you can imagine, the pelvis is a small place, so the instrumentation that the robot allows us, with the magnified view, with pneumoperitoneum, so less blood loss.
Yeah.
And really, it's almost an extension of my hands inside the patient without making a larger incision to do that. So to be able to do complex operations, reconstructions, kidney operations, partial nephrectomies, cystectomies, removing the bladder, any of these surgeries, I think the robotics platform has certainly taken the game forward.
And so I wanted to ask you, in terms of recovery for the patient, it's got to be way less recovery
typical
time.
Prostatectomy these days requires just one night stay in the hospital.
Holy cow.
And pain is less, the incisions are smaller. The largest incision is basically where the prostate comes out of, so just about 3 to 4 centimeters. And the recovery is much faster. Patients get back to normal life much faster. And one of the exciting things in the Santa Clarita Valley I would like to share is that Henry Mayo Hospital has recently got set up with the robotic systems.
Oh, nice.
So, now patients can have, complex operations right here locally, where the physician's offices are, where they live, where all their friends are.
Yeah.
So it's one thing to have operations, but if family can visit you overnight, if you can go home and if you have difficulties in the post-operative setting, you can 10 minutes away from the office where your physicians are. I mean, that's where I think the whole mantra of City of Hope, working locally with communities, is that we can offer all these cutting-edge treatments right here in their backyard.
And I don't think it's emphasized enough. Maybe I'm crazy. Maybe it is. But how much of a stress relief that is to have these facilities here in the Santa Clarita Valley. Because again, hopefully I never have to. But chemotherapy, I can only assume, is very hard on your body. And if you have to drive 2 hours after it, it's probably not a fun thing. But being able to have access to that here in the Santa Clarita Valley is something special. And again, you can go to cityofhope.org to learn more. Dr. Parihar, I wanted to ask you one quick thing. We only have like 2 minutes left, but I wanted to ask you, what are some of the preventative stuff that they can do? Because we talked a lot about prostate cancer, but maybe we can do urological issues as a whole, but what maybe specific to prostate, but what are some of the preventative stuff we can do?
Preventative urologic information, I would tell you that generalized, heart-healthy diet, routine exercise, those are the key for entire body, not just, urinary system. Smoking is, it's
don't do it.
One of the things that
every single doctor
yes.
that comes in here for the City of Hope show, no matter what it is, has
yes.
nothing to do with lungs, has nothing to do with throat or ear, nose, and throat. They say don't smoke.
A lot of media and a lot of people know about the pulmonary risks, lung cancer, COPD, those kind of things with smoking, oral cancers, but all those toxins get filtered to your kidney. So
even if you're breathing it in through your lungs.
It's a known risk factor for kidney cancer, bladder cancer, any other urothelial lining, in your system. And it can certainly raise risk of other cancers.
And you don't look cool doing it, people. You don't look cool. Right? So regular, diets are a weird thing. We were kind of talking about it during the break, that diets are a weird thing. But is there something specific to urologic things where you should avoid? My dad, who has had kidney stones, has told me don't drink a lot of dark soda and stuff like that. Is there anything?
Dark sodas usually have a lot of phosphoric acid.
Yeah.
Clear sodas are better, but the best is water.
Okay.
Usually about 3 liters of water, maybe a little more in this hot weather.
Yeah.
To have almost clear urine, to stay hydrated. In specific response to prostate cancer, there have been a lot of studies looking at vitamin C, vitamin E, selenium, lycopene. But a lot of the studies are mixed on whether it is beneficial or not, and it's just a placebo effect.
Yeah.
But in my recommendation, I think just overall healthy living, that's what we should all strive for.
Awesome. Well, Doc, thank you for coming in. I appreciate you being here. I appreciate what you do. I appreciate City of Hope. I'm glad you decided to make the trek west and come on by to the City of Hope. Go to cityofhope.org/Santa Clarita to check out their facility. It's also on Valencia Boulevard, right across from City Hall. Doc, thanks again for coming by. Mandy, always great seeing you.
Always great seeing you, too.
We'll see you next time. This has been the City of Hope Show on your hometown station, KHTS.
Thank you, Kyle.